Audio will now begin.
Hello.
Hello, this is Sandra, the nurse from One West at Park West Manor. Is this Mrs. Watson?
Yes, it is.
Oh, good. Mrs. Watson, I'm calling to let you know that your father had a little fall this morning. He's okay now, though.
Oh, really? What happened?
Well, when the night nurse was doing rounds, she found him on the floor between his bed and the bathroom. It was about 5 a.m. He was confused, but we figured he was going from his bed to the washroom and lost his balance. He wasn't using his cane, and now he has a swollen elbow, which will probably be pretty bruised. He likely struck his elbow on the bookshelf as he was falling. But he's okay. Anyway, there doesn't seem to be any other injury, and he's not complaining of pain anywhere else.
Oh boy, he is so stubborn about not using his cane.
I know. I guess we'll all have to really encourage him about that.
Yes, in fact, I also suggested that at night he could use the walker that I brought in. You know, he's shaky when he's half asleep and more likely to lose his balance.
Right. We have notified his doctor and left a note regarding the fall in his chart.
Okay, so please tell Dad that I'll come by to see him on my way home from work today.
Okay, no problem.
Great, thanks.
You're welcome. Bye for now.
Okay, bye.
You will now have 45 seconds to check your answers before going on to audio scenario 2. Audio scenario 2, questions 41 through 47. Phone dialogue number 2, nurse to physician. You will now have 45 seconds to look at questions 41 through 47 before the audio begins. The audio will now begin.
Hello?
Hi, Dr. Lee.
Yeah?
This is Sarah at Metro Health Sciences Center. I'm the nurse taking care of Mr. George Harley in room 812, bed 1. It's about his blood pressure. It was really low about 5 minutes ago. It was 72 on 41. I retook it twice and it remained at about that. I thought you should know.
Yes, thanks for letting me know. Is he lethargic?
Well, yes, he's been sleeping most of the day, and he wasn't very easy to rouse.
Okay. And how has his oral intake been?
Well, he's just had sips of water throughout the day, about 150 cc's.
All right, and so what was his output?
Let's see. I just emptied his Foley. It was 150 cc's over 8 hours.
Okay, well, I think he must be dehydrated. Let's try getting him to drink more fluids. So push fluids over the next hour. And does he have IV access?
Not yet, no.
All right, so how about rechecking his blood pressure in an hour after pushing some oral fluids? Then, if his systolic BP is less than 90, give him a 250 bolus of normal saline IV and let it run at 125 cc's per hour.
Okay, so push fluids, recheck in an hour, and a bolus if necessary. Thanks. And I'm assuming you want us to hold his PM dose of metoprolol?
Let me see. How much does he get tonight?
Well, he gets 25 milligrams metoprolol twice a day, so 25 milligrams tonight?
Yes. Hold that, please. I will reassess in the morning. But please don't hesitate to call me if his blood pressure does not improve.
Okay. Thanks, Dr. Lee.
No problem. Bye.
Bye.
You will now have 45 seconds to check your answers before going on to audio scenario 3. Audio scenario 3, questions 48 through 59. Shift-to-shift report, nurse reporting. The chart for audio scenario 3 on page 4 of your answer sheet has all the information you need to make your choices. You will now have 1 minute to look at questions 48 through 59 on the chart on the answer sheet before the audio begins. The audio will now begin.
This is the day report for October 23rd. Room 21A, Mr. Tom Payette is a 32-year-old male. He came into the emergency room last night with severe abdominal pain. He complained of nausea and vomiting for about 4 days before he decided to come in. The doctors did an abdominal X-ray and a CT scan and found that he has inflammation of the gallbladder. Right now, the doctors are going to decide whether or not to remove the gallbladder or do an endoscopic surgery. His vital signs are stable. He's alert and oriented and independent. This shift, he has not had any emesis, but complains of nausea. He is NPO and has an IV running into his left wrist, normal saline at 125 cc's per hour. We are giving him Maxaran 10 milligrams IV every 8 hours for nausea. Right now, he says his pain is a 6 out of 10. There is an order for morphine 2.5 to 5.0 milligrams every 4 hours PRN. I gave him a dose of 2.5 milligrams at 11 o'clock this morning, and that seemed to help. He states he had a bowel movement yesterday before coming to the hospital, but he has not had one here. He is voiding adequate amounts into the urinal. His wife is at his bedside now. She's really nice. They're a nice couple. You'll enjoy being their nurse today. Bye. Good luck.
You will now have 1 minute to check your answers before handing in your paper. This is the end of the listening comprehension test.
Hi, Lisa. My name is Diane. I'm one of the nurses here at the clinic. I understand this is your first visit here.
Yes, I'm glad to get in. I just want to make sure that everything's going okay with this pregnancy. And my family doctor suggested I see Dr. Khan.
Okay. I see from the chart here that you've been experiencing some spotting.
Yes, that's why I made this appointment. I've had a bit of spotting and I'm worried that I might miscarry.
Okay, well, it's a good thing that you came in. Spotting is definitely something that you need to have checked out. How often have you been having the spotting?
Well, it's only been once, about 3 days ago. Since then, I've been trying to take it easy, worrying that it might happen again.
Okay. Well, we're going to just fill out a form here. I'm going to ask you some questions, and then the doctor will come and see you and check things out. Okay?
Okay.
Can you tell me about your normal menstrual cycle?
Well, it lasts about 5 days and is about every 28 days.
Okay. And when was your last known period?
It was October 19th.
So this is January the 15th. So you are near the end of your first trimester.
Yes, I think I'm about 10 weeks.
And your last menstrual period, was it the same or different?
I don't remember anything different. It was pretty much the same.
Okay, I'm going to ask you some questions about past pregnancies. How many times have you been pregnant?
I've been pregnant once before. I have a son.
And what's the date of his birth?
Noah was born May 26, 2004.
Okay, so May 26, 2004, and you've had only one pregnancy, no miscarriage or abortion?
No, I haven't.
Okay, you have a son, Noah. Is he in good health?
Oh, he's been pretty healthy. He's really high energy.
And what was the weight of Noah when he was born?
He was 7 pounds, 3 ounces.
Did you have a vaginal delivery?
Yes.
The doctor will see you in a little while and check out the spotting. I need to ask some questions about yourself to evaluate any potential risks to you or the baby during this pregnancy. Do you smoke?
No, not anymore. I smoked a bit before I got married, and I quit before I got pregnant with Noah.
That's good. Do you drink alcohol?
Well, I've heard a lot about the dangers of drinking when I'm pregnant, so I don't drink when I'm pregnant. Otherwise, I might have a little wine now and then if I go out for dinner or have friends over. But that doesn't happen much since I've had Noah.
Okay. Do you drink coffee?
Yes, I like drinking coffee in the morning. Last month I couldn't keep it down, but I'm back to coffee again.
And how much coffee do you drink?
Maybe 2 or 3 cups.
Okay. And do you drink coffee later in the day?
No, I don't drink any afternoon.
Well, you need to know, Lisa, that it's suggested that you should not drink more than 1 cup of coffee a day while you're pregnant.
Oh, I didn't know that. Well, I'll definitely try to cut down.
Good. How are you feeling generally apart from the spotting?
Well, I've been feeling a bit nauseous, but that seems to be getting a little better.
Okay. Are you able to take regular meals?
Well, in December, I couldn't really eat anything in the morning, but by noon I was able to eat a light meal, and supper seemed to be fine.
Are you taking any prenatal supplements right now?
Yes, I started those in November.
Good for you. So would you say your appetite's back to normal then?
Well, I wouldn't say that, but I'm not throwing up anymore, and I'm able to eat a little breakfast now.
So when you were throwing up, how often was that happening?
Well, in December, I'd only throw up if I tried to eat anything in the morning.
Did you experience any weight loss?
Yes, in December I lost about 5 pounds, but I've gained that back now.
Okay. And what about bowel movements? Are you constipated at all?
No, I don't have any problems there. I usually have a bowel movement every day.
And how are you sleeping? Do you feel rested in the morning?
Well, yes, if I sleep through the night. In December, my son Noah was sick for a week, and he'd usually wake up once in the middle of the night every night. So I'd get up, and then I couldn't get back to sleep. So I was pretty tired during that time. And generally, I just don't have enough energy to keep up with him by the end of the day.
Does Noah take a nap in the daytime?
Yes, he usually takes a nap, but then he goes to bed later on in the evening. He's pretty high energy.
Okay. Are you feeling stressed at all?
Well, in December I was pretty stressed, and this spotting is worrying me now.
How about your home situation? Do you have any help at home?
Yes, my husband's really good with Noah, although he works from 8 in the morning till about 6 in the evening and is pretty tired when he gets home from work. But after supper he plays with Noah and usually puts him to bed around 8:30.
Okay, well it sounds like evenings are a bit of a break for you then.
In a way, I have to clean up after supper, and there's some odd jobs that need to be done at the end of the day.
Is there anyone else to give you some help?
Yeah, my mom just retired this year, and she lives about 5 minutes away. If I call her, she comes over. She's really good for that, and Noah really loves her.
Well, that's good to know. It's nice to have her around, I'm sure.
Yeah, I don't know what I would do without her. She's babysitting him right now.
Good. Well, that's the end of my questions, Lisa. I'm going to do your vital signs and take your weight, and then Dr. Kahn will come in and do an examination on you, okay?
All right, sounds good.